Hi everyone, thanks for joining. Just going to invite in our guest today.
Hello.
Hello.
Hey.
How are you doing?
Good. How you doing?
Very good.
Oh,
Thanks everyone for joining.
little boy.
Just have
Oh.
Dr. Anthony Chaffee coming online with us today. So thanks for joining, Anthony.
Yeah, no problem. Is your camera working? I'm not seeing you.
Oh, it seems to be. Can
Oh,
people
okay.
see me?
Yeah, I don't know. It's just not showing up for me, maybe.
Maybe people can write in the chat if they can see and hear both of us. I can see you and I'll request to join. You still not?
Yeah, still up.
Okay. Can anyone who's joined just write in the chat whether they can see two people or one person? Just so we know whether to restart it. See us both. Everyone can see us both. So
Okay.
that looks good.
Something wrong with I don't know. That's happened to me before, so yeah, I don't know. Whatever.
Okay. All right. Well, thanks everybody for joining us today. This is one of a series of Instagram lives that we are doing ahead of our Public Health Collaboration Conference in May. And it's a real pleasure to be joined by Dr. Anthony Chaffee today. We normally do these sessions at 7 p.m. UK time, but we didn't think it would be very kind to ask Anthony to stay up in Australia till that equivalent time. So this one is an afternoon slot. But what we're going to do is just talk a little bit about the upcoming conference and some of the talks that we'll be staging, and what Anthony in particular is going to be talking about, what he's looking forward to, and just make sure everyone's getting as excited as us about what's going to be happening. So thanks everybody for coming along to listen to that. Can you hear me okay? I think we've got Anthony's frozen up. Maybe we'll be back in a minute. Can you hear me, Anthony?
Yeah, I can hear you. Was that frozen?
Okay, now you're back. That's fine.
Weird. Yeah, I could hear you fine, but yeah, I don't know.
Okay, I think we're all okay now. So I'll just start off though with a little bit of an introduction to the Public Health Collaboration, as I'm conscious that not everyone may know of us who's joining from Anthony's feed, and just to give you a bit of an idea, we are a public called Public Health Collaboration. We are a charity based in the UK, and that exists entirely to really help people understand the importance of their own metabolic health, and to be able to feel empowered and educated to take control of that, and to avoid a chronic illness that many of us are seeing being had by so many of our loved ones these days. So we're a charity to try and aimed at educating people about being conscious of that and taking control of their metabolic health. And we also have some very specific programs that are designed to change not only people's understanding and knowledge, but also the system itself, so the healthcare system, the education system. I'm just going to pause there for a minute because Anthony has frozen again. I don't know if it's your signal, Anthony, but it seems like... Oh, now he's back. Okay, thanks for letting us know in the chat so we know.
Yeah, so no worries. I mean, I'm still hearing you guys, so I don't know. Maybe it's just something about my video or something. Yeah, so either way.
Maybe you're going very still, so just keep moving.
Yeah.
So where was I? Yeah, so we are a charity that is about educating people, both healthcare practitioners and the public, about metabolic health. And we are also running many projects that help change the actual system from the bottom up. So an example would be where we are working with the NHS to actually help people reverse type 2 diabetes and taking people out of the system to help them understand how to do that. We have a program which is helping people reverse food addiction that we're piloting at the moment, which is very exciting, and a program to actually change some of the education components in our primary and secondary schools so that kids can get exposed to nutritional information during their educational years, and to understand how to read food labels and compare food labels and understand what processed food is, ultra processed food in particular, and know how to avoid it for their own future and their own health. So we run many programs like that, which is actually trying to change the system from the bottom up. And we also have other activity that we do to try and also change it top down. But a lot of what we're doing at the moment is to start with the grassroots movement. So hopefully people will learn a bit more about us and support us in that endeavour. And our main annual events, our main event of the year in the calendar is our conference that we hold around May time every year. And this year it's going to be held in London, and it's going to be on the 18th and 19th of May, which we're all very excited about. We have a fantastic lineup. If you haven't had a look at it, please do, on our Instagram page, and lots of exciting talks that we are looking forward to bringing to everybody. So we'll get into that a little bit more. But before we do, Anthony, do you mind if I ask you to introduce yourself in case anyone isn't aware of your background and how you got into this nutrition space?
Oh yeah, well, I mean, briefly, yeah, I'm an American physician, and I currently work in Australia as a medical doctor. I've just had a particular interest into diet, nutrition, and how that affects health and chronic disease and athletic performance just from an early age, just because I wanted to be a doctor, and I always found that nutrition was a big part of health, and obviously that was important to know about if you're going to be a doctor. And also as an athlete, and I wanted to know what the best fuel was for my body, and so I was very particular about what I ate and what I did. And so I've just spent a number of years, probably around 25 now, looking at diet, nutrition, and how that affects all of our lives. And as a doctor, sort of looking at how optimal nutrition plays a role in our health and chronic disease.
Yep. Excellent. Thank you very much. And obviously you are someone who advocates for removing plants from the diet as one of those improvements that we can make to nutrition. So that's been a great perspective that we've used last year. Unfortunately, you weren't able to join us in person, but we did manage to still include you in our lineup last year via Zoom. And we had a great discussion about whether or not we need to have plants in the diet. So if anyone's interested in that YouTube talk, that's on the Public Health Collaboration YouTube channel that Anthony was involved in and participated in at the conference last year. So thank you for that. And then looking forward to this year, we have quite a lineup, but maybe if we start with what you're going to be involved in, Anthony, which is a discussion debate about whether or not red meat shortens lifespan. Do you have any particular thoughts looking ahead to that as to what you want to make sure is landed as far as the main points, and anything you're expecting will be a challenge to that?
Well, I mean, I expect the challenges will be a lot of epidemiology about how meat and red meat is associated in weak, poorly designed studies by criminal activists and special interests to have some sort of association with decreased lifespan, or you might bring up the blue zones or the China study or some other fraudulent piece of nonsense, which will be great if they do, because that'll be an easy short day at the office. But I just want to land home that meat does not cause harm. It is something that we've been eating since we've been humans, as Dr. Berry says. As long as humans have been breathing air and drinking water, we've been eating meat. And so why would it hurt us now? Why would an ancient diet cause new diseases? Because these are new diseases. And people can go into the idea about average life expectancy, but they're talking about, well, cavemen, yes, they may have eaten meat, but they died at 30. I don't know how you know that, because I don't see any census bureaus around during the ice ages last time. So I don't know where people are getting that from in the first place. The more modern examples of hunter-gatherers actually live quite a long time. It's just the infant mortality rate is high in these populations, and so that's going to bring the average life expectancy from birth down. But that did the same thing for Americans and Europeans up until the early 1900s, when they started fixing a lot of causes of childhood death and disease, such as getting potable water, and understanding that you can drink from Dr. Lister figuring out that certain water sources were killing people, and figuring out potable water and how you could get contaminated, sort of thing. So just pointing out that this is something that we've always eaten, that prior to agriculture people were much healthier, they were much taller, had bigger brains, were much more healthy. If you look at pre and post agriculture, much healthier before agriculture, much less healthy after agriculture, every time you look at a population that switches over. And so why would you say, why would someone argue that if you objectively get shorter, dumber, less developed, and have more diseases and examples of chronic disease and infectious disease and poor wound healing and other signs of poor health, why would you think that these people were healthier for some reason when they went away from meat? That doesn't make any sense. And so there are numbers of examples in the anthropological record now of people being much healthier, living much longer, and even with much poorer conditions, and yet they live just as long as us, if not longer than us. And then there's many other studies, or more recent studies, looking at 175 different countries, correcting for socioeconomic differences and other sort of confounding factors, and found that in every single country, in all 175, that higher meat consumption was associated with better health and longer life, right? And then populations such as Singapore and Hong Kong, which are now the longest lived people in the world from average from birth, and they also eat the most amount of meat per person per year. And so the idea that meat is somehow detrimental to our health is flatly false and patently false. And the idea that it shortens our lifespan is just strictly against the evidence.
Yeah, that would be good. And you mentioned about the blue zones, and it's certainly a part of the narrative I think persists. Certainly if people start to investigate, they will come across very quickly that the blue zones is used as evidence to suggest that that eating less meat is conducive to a longer life. So I expect that would come up. And why do you think that continues to persist? I mean, there's a Netflix documentary about it right now, kind of centered around the blue zones. Why is it so hard to kind of bring down as or kind of challenge with a different viewpoint, and for that to get through to the mainstream, do you think?
Oh, because no one spent millions of dollars to counter it, and to put the narrative out there, and to counter the narrative, and to pay a bunch of news organizations to run that narrative, and to make Netflix documentaries and specials countering that narrative and show that it's nonsense. So, the Seventh-day Adventists and Dan Buettner, who is a Seventh-day Adventist church member, they've spent millions doing this and pushing this out there. I mean, they started this whole charade back in the 1800s, and they have not stopped. This is not some weird little puritanical movement that just sort of lingers on like, circumcision, did with Dr. Kellogg's. He sort of pushed this, myth that to be hygienic, boys needed to be circumcised. That was not what he wanted. He wanted to deter masturbation and sex, and that's what he wanted. And so he lied and convinced the medical establishment in America that it was about cleanliness and hygiene. He tried to do that for girls too. He wanted girls to be circumcised as well, which is just barbaric. And and that has persisted. even though if people figured out how to use lube. So, that didn't really stop anybody from doing what he didn't want them to do. But even though it didn't actually meet the goal that he wanted, that myth is still there. And because he's dead and no one has ever, really pushed this out in, in any sort of large scale way. So that's the thing, they're still pushing this stuff out. If it's like the Dr. Kellogg's thing, he just sort of put this out there and then he died and it never got erased. But the Seventh-day Adventist Church are still pushing this stuff. They are still trying to push this idea of a plant-based diet on the world because of their religious convictions. And so, they bought the Blue Zone rights for like $68 million from Dan Buettner. They got a lot of money to spend. They make, I don't know how much, but they have multiple cereal companies. The largest cereal company in Australia is owned by the Seventh-day Adventist Church, Sanitarian Foods. They make Wheat Bix, and they sponsor major sports teams and all these sorts of things. And they sponsored the New Zealand All Blacks rugby team for a while, and so they were sort of going carnivore, but they were like, no, you have to eat Wheat Bix and all that sort of crap. And so there isn't millions of dollars being pumped out in the other direction. The facts are there. It's a known lie, but it's right now it's just being carried out by word of mouth, and it is getting out there, but it's it's just going to take longer. So until we start fighting that and start getting, that's the thing. They have a product at the end of this, right? They're selling cereal. Like, we don't have anything. We're not selling anything. So there's no counter product to this. It's just the truth. And so we're trying to get the truth out there, and it is spreading. But if we had a product and we could, Pepsi has, $2 billion marketing budget a year, right? So they can push out a lot of false narratives and bad press about the different things that they want to. So but we don't have that. If we have to sort of do this by philanthropy, we have to do this by word of mouth, and we just have to have people just understand that this is garbage. But it's harder to do it that way. It takes longer, and as they say, lie can go all the way around the world before the truth gets its coat on. So it's just something we have to fight against, and just be adamant about that. When people bring up the blue zones, people just need to know why this is garbage, and to be able to regurgitate that. So when people are sort of seeing this and watching the two sides and saying like, oh, I don't know, blue zones sound good, but nope, that guy makes some really good points. So, I'm not going to fall for that. That's an important thing to do just for all of us.
Yeah, absolutely. And that's exactly why we are doing it, because there is that vacuum, which isn't bringing these different arguments together and actually testing them against each other. And I think that's what's so important about having debates like this. You're going to be joined on that debate by Dr. Ben Bigman, who I know you know and haven't met before. Is that right? So are you looking forward to that?
Not in person.
Yeah. Are you looking forward to that? What do you think he can bring to the argument?
Yeah, no, I'm definitely looking forward to that. I really like Ben. He's a really nice guy, very smart guy, and very knowledgeable. I mean, this is his forte. He's a professor of biochemistry, and really understands the body and the metabolism, and understands how important it is to eat meat, and to eat properly, and to eat in the way that that humans are designed to eat. And he understands how humans are designed. He's looking at this, going like, yeah, you eat these things, it's going to be a problem for your body. And so, no, I think he'll bring a great argument to bear. I'm not sure exactly what his approach will be, but I'm sure it will be extremely interesting and very very fruitful. I think that it'll probably be different from mine. Mine talking about more historical and anthropological and evolutionary biological point of view is probably going to be different than his. I would expect him to be more technical and looking at how the body's designed and how it works, and how there's just literally nothing in meat that is a problem. Because that's the thing, you have these associations, and they say, well, there's when people eat pizza and beer and all these sorts of things, that's all meat. Obviously, those are all meat eaters, and those people are associated with shorter life and ill health. there's not a single thing that they can point out in meat that's bad for you. I mean, they try the saturated fat and cholesterol, and that's just been a lame duck from the beginning, and certainly now. And that has just been roundly disproven. The Journal of the American College of Cardiology published a landmark paper in 2020 looking at all the randomized controlled trials and meta-analyses of randomized controlled trials to do with saturated fat and cardiovascular disease, and they found absolutely no correlation whatsoever between increased saturated fat intake and cardiovascular disease. So that's over. And in fact, they found an inverse relationship between saturated fat and stroke rates. So people had less strokes if they ate more saturated fat. So this is, that's just a dead duck. The idea that cholesterol caused heart disease, that was, again, just an invention from the sugar companies and cereal companies. They were trying to push their ideology. And cholesterol is really good for you. Cholesterol, you're supposed to have it. That's why your body and brain makes it. And so the idea that we need to just stop our bodies, that maybe one person, maybe a few people may have some sort of issue that would make them make too much, and maybe that harms them, maybe. But the entire population of planet Earth, really? Just everyone is just so poorly built and designed that we're just pumping out toxins to kill ourselves at all points. It doesn't make any rational sense. That doesn't happen anywhere else in on any example of life on Earth, that species is just trying to kill itself constantly. Something like maybe a lemming or something like that. But its body is not pumping out toxins to kill itself. That doesn't make any goddamn sense. And so, that I'm sure he'll be able to roundly disprove any of those sorts of things. Or it increases mTOR. People are they're losing sight of the forest for the trees. They're saying, but what about this tiny little one mechanism in the body of this one chemical? It's like, that just changes everything. Maybe, but probably not. We're a complex system. We have tens of trillions of cells. They have tens of trillions of chemical interactions inside each cell every second. And the idea that you can extrapolate an entire systematic breakdown based on one chemical interaction, it just doesn't make any sense. So, I'm sure he'll be great at dismantling those sorts of arguments.
Yeah, absolutely. And we actually will have a separate debate specifically on whether or not cholesterol causes heart disease, which is on a different day to your debate, but is the other debate that we're going to be staging, and that is going to be interesting. That will have Dave Feldman on that panel with Adrian Sotomoto, who've done a lot of work on the lean mass hyperresponder trial, and going to have some of the results that they can share, most recent results that they can share at the conference as well. And we will have some opposing speakers who are very much part of the establishment, who do have a very strong view that high LDL is still causative, or it certainly needs controlling through statins. And it will be really interesting to see those ideas come together and hear some challenge back and forth, and allow people to make their own judgment about what the right position is and where the nuances lie. So that will be another interesting debate for people to come along and watch, or live stream in to watch, but I'll talk a bit more about that. So just looking at the rest of the agenda, obviously I've just mentioned the other debate, but is there anything in particular that catches your eye that you are looking forward to hearing? Just to give everyone a bit of an idea, we are starting off day one with quite a lot of talks and a panel on type 2 diabetes, which is going to include Gary Taubes, Ken Berry, and David Unwin. So quite a dream lineup there. And we'll also be talking about mental health on day 2 with Dr. Rachel Brown and Dr. Ian Campbell, who's doing some fantastic investigation into bipolar and diet. And we will also be talking about ultra processed foods, and we have Eddie Abu joining us for that on the second day to help us understand how we can save the next generation from ultra processed foods. So some really interesting talks all round, and I wondered if anything on that is particularly catching your eye, or is anyone in particular you want to hear from?
Oh, all of them. I mean, I think they'll all be fantastic. It'll be great to hear. I mean, obviously, I treat people with diabetes with, a proper human diet and carnivore diet, ketogenic carnivore diet, and so I know how powerful that is. It's gonna be great to hear other doctors and clinicians' experiences with that and presenting their patient populations and evidence and as well. So that'll be great. But I think that's so important because a few years ago, no one no one thought for a second that diabetes could ever be cured or reversed or turned around. It's a progressive chronic disease. Like that's what it's defined as. And so it only gets worse. You can slow it down, you can stall it with diet, lifestyle, and medications, but it only got worse. And that's not true. It goes away if you just change the way that you eat, specifically to a more appropriate, biologically appropriate diet for humans. And so that's something that really needs to get out there because I think that's one that's going to really shake the medical world because if that gets shaken, brought down, like no, you can reverse this with just these lifestyle changes. Okay, well that opens the door to everything else as well. And then they have to start listening to all these people that are reversing all these chronic diseases and improving in other ways. And now the ketogenic diet is actually in the national schedule for treating diabetes in Australia as part of the medical guidelines, and that was pushed by a Dr. James Mukey, who really fought for that, and thankfully got that on there, and that really protects doctors in Australia from getting backlash from the medical establishment for actually doing their job and curing disease. But if you do it in a way that they don't like, you can lose your license, even if it works. And so now now that's establishment medicine now. That's mainstream medicine. And so but it's not something that almost anybody knows about though. So that's going to be a great one to get out and to get out to more clinicians and practitioners because I think that's going to be, the opening of the floodgate. That's a crack in the dam that's going to take down the whole thing. I think, or at least it's gonna really open a lot of eyes when that becomes, mainstream knowledge. The cholesterol one, I think that one is just, the whole idea that cholesterol causes heart disease. I think that is just an idea that is long overdue to die. And so, the more of these we have, and just hammer this home that this is just a complete fraud from the beginning. I mean, the simple fact is that no serious scientist independently came up with the idea that cholesterol caused heart disease. That was entirely an invention of the sugar companies, and then they paid off unscrupulous doctors and researchers like Ansel Keys and most of the faculty at Harvard. Nothing's really new there. To lie and push this idea, and that was to protect their own investment in sugar, because there were serious scientists who independently came up with the idea that sugar caused heart disease, and they were showing this in strong correlation between the rise in sugar consumption, refined sugar, and processed foods, and the rise in heart disease, which is a brand new disease in the 20th century. I mean, the first death from heart attack confirmed on autopsy was in 1912 in America. There wasn't a single case of anybody dying from heart disease before 1912 in America or in the colonies before that. There's a scattered few case reports in the literature in Europe before that, but it's like hardly any. But autopsies did show that there was some atherosclerosis and some buildup and things like that. So there was something there, but they recognized it as abnormal. They're like, yeah, we don't see that normally. That's different. What's that about? And so it was documented. Even going back to William Harvey, Da Vinci wrote about it. I mean, this is going back, but they never saw a heart attack. They never saw a thrombus in the coronary vessels that killed a large portion of the heart, scarred it down, ruptured later. I mean, those are very, very clear signs when you have a damaged heart to the extent that it causes a fatal arrhythmia, or it scars down, thins out too far, and then ruptures. That's another way that people can die as well. And that's nowhere in the literature, apart from a couple of things. But people could see every now and then people died of a heart attack. Every now and then people saw evidence of atherosclerosis. So, the idea that this just went from being largely unheard of to then the number one killer in America in 20 years, when we're eating the least amount of meat in 200 years, is ridiculous. We were eating far more meat in the 1800s than we were in the 1920s and 30s, and yet no heart attacks in America, right? So that's an idea that just needs to die. I mean, this is like we're still having like the congressional hearings with the tobacco companies, 30 years ago, 40 years ago, where they're saying like, it's like, hey, well, these are bad. These cigarettes seem to be bad for people. There's all these studies showing that it's bad. Oh, well, our studies say that, it's really good for you and makes your hair grow. And it's just like, geez, everyone knew they were full of crap, and but they didn't have like hard evidence of it, and so they just kept playing this game of, I guess we need more studies, and if you need more studies, what that means is you get to keep your poisonous product on the market a little bit longer. So you just keep playing that game, and you just keep selling your poison to people, and just like the tobacco companies, they tried to get candied cigarettes and toys and games that involve smoking to get kids interested in smoking from an early age. What do sugar companies do? They target children, and then you target children, they get a sweet tooth, they get addicted to sugar, and then they're eating sugar the rest of their life unless they're fighting against that for a long time. So that's something that needs to go away and die. I'm really looking forward to meeting Dr. Unwin, seeing Dr. Berry again, and Rachel Brown. She's fantastic. I absolutely love the work that she's doing in psychiatry, and so I'm really interested to see that work being done by bipolar patients. And Eddie Abu, that guy just cracks me up. I think he's awesome. So it'll be great to see him live in action and meet him and Ben Bickman. I'm very excited. Everybody there are people that I either like or would like to meet, and so I'm very excited for it.
Oh, thanks. Yeah, we're so excited too. But yeah, you touched on pretty much everything there. But I think when you talked about diabetes, it's very exciting that, as you said, the guidelines are changing in Australia, and just recently Dr. Peter Bruckner has actually changed some of the guidance from the Australian Diabetes Association. Is that right? That was coming out this week, I think.
Yes.
Which is quite
What, sorry?
Australian Diabetes Association.
Was he
I think that's the name of it.
Changing it again? Oh, I hadn't heard that.
Oh, okay.
You know what's getting changed?
I think he has got them to change their guidelines to move more towards low carb as the advice that they give out, the Australian Diabetes Association. I saw something about that this week.
Yeah. But, for diabetes patients. Nice.
Yeah. So yeah, it's great to see all these changes are happening. And I think you're totally right to say, about the dam breaking, because we were talking the other day with Dr. Erin Bellamy, who's one of the other metabolic psychiatrists that will be joining us, that she really believes that the mental health side is going to benefit from how diabetes has been the first condition off the blocks that has really been pushing to look at this whole thing differently and to start to address lifestyle as the main way to treat it. And she thinks that it has taken a long time for diabetes, but once that one has got through and has explained and has kind of set the precedent for what is possible, that many other conditions will take a lot less time, and you'll get lots more economies as we can start to build the same argument for those as well. So we're all really hopeful that the more we keep pushing, the more these things are just going to become much more accepted in people's kind of minds and part of the narrative. So we can move away from where we are at the moment. So thank you for all of that. And I think I was just going to ask you about more generally about organizations like the Public Health Collaboration and how you kind of see them in the mix of all of that change that needs to happen. What role do you see them playing, and whether it's Public Health Collaboration or other organizations like us? So maybe other people can think differently about these organizations and how it's important to support us. What's your view on that?
Well, I mean, I think it's vital to get this out to clinicians and lay people and patients, because otherwise it's not going to happen, right? There's no product at the end of this, right? This is just there's only one dog in the fight right now, and that's processed food and big pharma. They're just pushing out this nonsense to have us eat rotten food that's toxic to our bodies, and stay away from the only healthy thing that is available for humans to eat, which is fatty meat, and that's to sell their product and to push that poison on us so that they can make money, and then we get poisoned, we get sick, and then that makes them more money because then they sell us all these poisons, masquerading as medicines that are just sort of keeping the ship afloat while actually getting wrecked by this storm. So it's the only way to get this information out there is to have these conferences and to get these debates out there, get these out on the public forum, and so people are talking about this because people are, oh, no, it's what I think. No, it's what I think. Okay, great. Let's talk about it. And then people can look at that and they can they can decide for themselves what they think. And that's the only way to do this, because right now we have billions of dollars being pushed in the other direction. And we don't have a way to combat that, financially. So we have to do it this way, and we have to educate people. And we have to educate doctors and clinicians, and hopefully start getting some more people with a bit more political clout to start saying, "Hey, look, this is a problem too." I mean, I don't get political, but Robert Kennedy Jr. He's at least the only politician I've heard in, I think, my lifetime talking about how we're getting sick. We're sicker than we've ever been. I mean, this is from toxic exposure. This is from eating crappy food that doesn't belong in our bodies. And that's absolutely fantastic. So when we can get the message loud enough and get more of these projects going, get more of these debates and conferences going, so more doctors can see this, more doctors can say, well, I think cholesterol is a good idea. Let's watch this debate. Oh crap! No, actually, that looks like maybe I need to look into this a bit more. That's how this is going to spread. When we get patients to understand this, obviously they can take control of their own lives. But when we get clinicians understanding this, then they get to influence their entire population base and their colleagues. And so that's gonna have a much bigger effect. And then it doesn't matter what the marketing budget is for these companies, because people will know better. So this is really the only way, the best way that we have right now until we start getting some big budgets behind some marketing campaigns and some political leaders in our corner, that this is the best way to get the information out there and to get the data out there and get the research out there, and maybe to inspire other researchers to say, that's a good question. I'm going to run an experiment. I'm going to see what I can find out. That's what we should do. And because of these sorts of conferences and these talks that I've done and other people have done in the public setting, I've had people contact me saying, "Hey, I saw your lecture on X, Y, and Z. It's really interesting. I'm a PhD candidate for nutrition, and I think I'm going to do my thesis on this, on plant toxins, on looking at this and seeing, if and try to do a study looking at the carnivore diet people." Like, that's what we need. So this is how we get this information out there. This is how we get doctors and researchers a voice and a platform to reach a lot of people and to influence and inspire other clinicians to take on this mantle and look into it themselves, and other researchers to start taking up their research and start putting that in that direction as well. I mean, Dave Feldman is an engineer, and he just sort of fell into this because he started doing it and went like, oh wow, this is making a big difference, and so that inspired him to say, okay, I want to see what's going on. I don't think the mainstream narrative is correct here. I don't think that people getting a lot healthier but their LDL goes up is necessarily a bad thing. If everything else is improving, why are we saying that a higher LDL is a bad thing? maybe it's not a bad thing. If everything is improving, maybe that's the trend, and maybe LDL going up is a good thing as well, and that's actually what he's been showing now. And so, the public health collaboration and programs like this are able to do that. They're able to give people a voice and to get research out there that's actually going to help people, as opposed to pushing a product and pushing an ideology, such as we've been seeing now. And the vast majority of research coming out is ideologically driven or financially driven. And so this is really our best way to combat that.
Yeah, absolutely agree. And as well as all the education that you just mentioned, what we as an organization in particular are also doing, as I mentioned before, is actually going and changing the system, going and changing the programs that are being offered to patients, changing the education for kids, helping people deal with these diseases. So, I think, and as well as what you said about, not having the same kind of investment and funding as commercial organizations, it's really important for organizations like us to get the help from the grassroots that we are doing this for and doing this with, because there isn't going to be, we don't take industry funding, there isn't going to be anyone else that has any advantage in investing in us apart from the public. So we really do welcome and appreciate every bit of help that people can give us, and the best way to help us is to come along to our conference if you're in the UK, or if you want to come to the UK, please do to come along. It's going to be worth it, and many people did last year, in fact, fly in for it. But if you can't attend in person, then just last week we have introduced live stream tickets, so you can join us from anywhere in the world. And I'd really recommend it, especially for the debates that we talked about, to be able to watch those live and not have to wait to watch them for many months before they come onto YouTube. So that would be, the best way that we would to get support, and all the proceeds and everything that we get go channeled into the programs that I mentioned. So every contribution, even though you get a great experience from it, will also mean that we're able to actually change the system and change the way that people's health is dealt with in real life. So we really do appreciate people supporting us on that mission. And I do think that the consistent feedback that we do get every single year when we've had a conference is, if you can come along, it is a fantastic experience. You meet so many people that you never imagined meeting. The community is very uplifting, and people go away very inspired and want to make changes that are precipitated from having this experience of everyone being together. So that's something that isn't quite captured in the live stream. So if you do have a choice and you do have an option to come along, then we'd really recommend it. And I'm sure all of our previous attendees would say the same thing. So we are hugely excited about it, and very excited about you coming over in person this time, and looking forward to all of our speakers coming together and us having all these amazing talks. So so thank you, Anthony, for your time to look ahead and to get right into it all. Hopefully that's left everyone with a little bit of a flavour for what's to come, and we really are looking forward to having you over here so that we can make it all happen in May in London. So if anyone would like to book tickets, please have a look at the link that I will add. But it's the Public Health Collaboration PHC UK org /conference, and that's where you can check out all the available options for joining us. So that is all we wanted to cover today. So thank you. I know it's very late for you, and but thank you for your time. And we will be really looking forward to seeing you in May. Is there anything else you wanted to say as a final thought?
Well, I was just to ask you to make sure. A couple of people asked. I just want to make sure. What day is my debate on again? Is that the Saturday or the Sunday?
It is, at the moment on the schedule, it's the Sunday, but there is a likelihood we'll be moving that to the Saturday for anyone who's listening that is planning to come one particular day or the other. So keep an eye out on our website, and that is going to be updated shortly. And it's likely that the cholesterol panel will move to the Sunday. But yeah, have a look at the schedule, and that will be updated in the coming days or so.
Okay, sounds good.
Excellent. Okay, well, thanks everybody for joining us today, and we look forward to seeing as many of you as possible in May, and see you then as well, Anthony.
Yeah, see you then. Thank you,
Okay.
everyone. We'll see
Thanks
you next time.
everyone. See you soon. Bye.
Yeah, bye.